to say. I was going to say, I hope the rest of your month goes good, but that's not going to work. I mean, I do. Thank you for joining us for another episode of Branching Out with F&M Bank. I'm your host, Mary Pavlovskaya, and today I'm joined again by Dr. Yuriy Zhukov, cardiothoracic surgeon at Sentara RMH. Thanks for joining me again.
My pleasure.
So today I really want to discuss what has happened at Sentara RMH. What's been the change that you've seen from a year ago to now in impact with COVID?
COVID has been, and it's not even an overstatement, COVID has been a shock to the system for the entire country, for every single family, for every single person. And we're not an exception. COVID has changed how this hospital runs from 18 months ago to now. And I think there have been both positive and negative changes. And the negatives are easy to focus on, but I think they're less important. I think we've seen struggle, we've seen burnout, we've seen difficulties with how do we logistically accommodate this new problem that we haven't dealt with before? How do we accommodate so many patients that are critically ill? We haven't seen that. And at the same time, how do we continue operating? How do we continue taking care of patients who don't have COVID, but yet they need medical care? And that's the easy part to focus on. I think the better part to focus on is how well we've done it and how well this community came together, both medical community and community at large. I think it is inspiring to see what doctors and nurses have done in this hospital. And COVID affected us, division of cardiothoracic surgery to some extent, and division of cardiology to some extent, because the patients are different and their needs are slightly different, and there are nuances to how do we provide heart care to patients who now have COVID or risk of COVID. But the critical care doctors, the nurses, the medicine doctors, they have been the front line, and how well they came together and what they've accomplished and what they've learned, and how, seeing how well they can manage the same patient now as opposed to when we just learned what COVID is a year ago is absolutely amazing. And then of course, the breakthroughs we've had in the last year. I think the patients who have a chance now did not have a chance, a year ago. Patients who are at risk, who were at risk a year ago now are able to get the vaccine and hopefully never have the disease. So that is amazing to see. And then I think the most important part is how much support we felt from the community, because it was easier for people who aren't in these essential businesses to say, well, we can work from home, or we can somehow mitigate the risk. And yet the doctors and nurses in the hospitals were thrust to face the same patient that's on oxygen, same patient that's super sick, and now you can't work from home. You have to come to the bedside and do your best. And so we've had a tremendous support from RMH Foundation, from the community, with donations, with PPE, with anything that made this dark time a little better.
Yeah, I remember reading that there was a mask shortage at one point in the beginning of 2020, and the community kind of stepped in and helped a lot with that. And I know you had mentioned, because you sit on the board for the RMH Foundation, that you saw a lot of influx of food even being given so that there's support to the staff of the hospital.
Yes, and I'm sure, I'm not even the best person to describe this, but we have seen a constant support from this community, which is what we needed. This was a very difficult time, and I think this was great. We have learned how to provide medical care with the COVID, and once again, in the past year, twice we had to change, at least in our division, what we can do with cardiac surgery cases, cardiac surgery patients, because of the COVID spikes, one last spring and one around the holidays. And certainly now we're better than we were last spring, a year ago. So we're learning a lot. We have continued performing procedures that need to be performed, life-saving procedures such as valve replacement, transcatheter valve replacement, certainly taken care of lung cancer and taken care of cardiovascular disease.
Now tell me a little, I understand you guys have a recognition that you've recently been awarded. Tell me a little about that.
Thank you for asking about that. So Sentara RMH has been recognized by IBM Watson as one of the top 50 hospitals in the United States, and this is the second time in a row.
Wow.
And I'll tell you a little bit more about it, but what happens is they look at the data from Medicare patients and they see which hospitals do better with patients with cardiovascular disease. You have PCI, have coronary bypass grafting, you have all aspects of cardiovascular care. And they look at all of the hospitals. So this year there's approximately 20 hospitals there that have a training program in cardiovascular medicine, and Mayo Clinic Rochester, where I trained, is on that list, and Duke is on that list. And then there's 20 hospitals who are training hospitals, but they do not have training program. And there's many wonderful hospitals there, and there's 10 community hospitals, just 10 in the United States. And Sentara RMH is one of them for the second time.
That's incredible.
And and what does it mean? Well, okay, it's great. Well, first of all, this is an independent review. You don't get to ask for it. They choose the hospitals. We have no say in it whether we participate or not. We're told, hey, this happened. So if all of the hospitals in the United States performed as well, more than 7,000 lives would be saved annually. More than $1.5 billion would be saved annually, and then approximately 5,000 patients who have either bypass grafting or percutaneous coronary intervention would leave the hospital without having a complication. So extra 5,000 patients do not have a complication. So we're very proud of it, and it's through work and dedication of physicians and nurses, and it's something that we're going to continue working on. It's a work in progress. It's a constant work in progress.
That's great. It's like a community within the hospital itself being supported by the outside community of where it's located in. It's kind of what I'm hearing from the two sides of what we just talked about.
That and despite COVID, we're going to say, I think the message is despite COVID, despite all the turmoil, despite all the troubles, I think we're providing a wonderful care to this community. I can, with a straight face, say that we, and I have trained at Mayo Clinic. That's my background, and I hope to continue kind of carrying some of that legacy. And I think for the appropriate patients, we wouldn't do certain things that Mayo Clinic does, and that's okay because we're different hospital. But I believe that patients that come here get Mayo Clinic level of care. They should expect it.
So thank you again, Dr. Zhukov, for having this conversation with us. And I hope at some point you and I can have a conversation without wearing a mask and post-pandemic, because I've thoroughly enjoyed learning about heart health and what it's done to the community and ways that we've been supported. So
You're welcome.
I appreciate it.
You're welcome.
Thank you for joining us for another episode of Branching Out with F&M Bank.